Joining us now is professor at Northwestern University Medical School and WGN Morning News medical contributor, Dr. Lauren Strecker. Good morning.
Good morning.
So let's start off with alcohol and the Surgeon General.
Yeah,
what is the
it's
latest?
a big topic of discussion because, of course, the Surgeon General wants there to be a warning on every bottle of alcohol. Not just a warning, but like a neon sign that says, do not drink this. And when you look at this controversy, there's really a lot of different aspects because there's the medical, and then there's the political, and then there's the financial, and then there's the cultural. So let's stick to the medical for a second, okay? It is not a controversy. We've known this for a long time that alcohol is associated with 7 different kinds of cancers, maybe more. Breast cancer, 1 out of 6 women that gets breast cancer, it can be attributed to alcohol. There are a lot of other, of course, medical conditions that go along with alcohol. Not a controversy. 50% of people, there was a study that was done, have no clue. They do not know. They are not aware that drinking alcohol can cause cancer, which is what this is all about. So the controversy is how much? You know, is it okay to have a little alcohol? Should there be no alcohol? Medical experts are all over the map on that because there's so many other circumstances that are going to impact on how much alcohol is going to harm someone, other risk factors for cancer, et cetera. But that doesn't really matter. What really matters is the idea that there is an association. Okay. But then you get into the bigger picture. Okay, first of all, is it going to make a difference? You know, how many people read those teeny little labels? Is that going to change their activity? Is that going to change their decision-making process? I don't know.
But we've always heard, I was doing this show for many, many years, 1 a day for women is okay, 2 a day for men is okay. Right. Is that too much?
Well, that's the controversy.
What do you think?
I don't know.
Okay.
I don't know because there's so many other factors. There's a big difference between, first of all, let's define 1. I mean, a lot of people, their 1 is like this. But, you know, if you're really going for the 6 ounces and all of that, it really depends on other risk factors. You know, if you look at someone who's maybe taking other medications, who doesn't have a healthy weight, there's so many other things that can impact. Right. So what's very clear is, we tell people like this in pregnancy all the time, we know that none is good. We know that a lot is bad. At what point do you get fetal brain damage? You don't really know, and there's other things that impact. So I think really for me, the message is you need to be aware that there are problems, and you need to either cut down, if not cut it out altogether. And I don't know that the label's the way to go. I would like people to get educated on this. They should know so that they can make their own decisions based on their other risk factors and how much they care. I mean, I don't know if you knew that 1 out of 6 breast cancers was associated with alcohol. Would that change your way of thinking? Women are so afraid of taking estrogen, which actually decreases the risk of breast cancer. And they have no problem saying, I'll have another glass of Chardonnay, please. You know, so there's that. There's really so much behind this. Are we going to start putting labels on processed foods? You know, every bag of potato chips is going to say this is going to cause cancer. On meat, if you eat meat, it's going to increase your risk of colon cancer. So what is the responsibility of the government? Should there be these warnings?
And would that even influence behavior?
And would it influence? Would it influence? I mean, to me, that's really what it comes down to.
Makes sense.
All right, next topic, how your blood pressure is taken is important.
I was curious about this, because you get different blood pressures sometimes even when the nurse takes it versus when the machine takes it.
Well, more than that. I mean, okay, look, you know the drill. You go to the doctor, they weigh you, they give you the icky paper gown. They sit you on the exam table, and then someone comes in and takes your blood pressure. Wrong. Wrong. What we know is that the proper way to take a blood pressure to get an accurate reading is, first of all, you've got to use the right size cuff. People come in all sizes and so do cuffs. You must be sitting in a chair with your feet firmly planted on the ground, and your arm should be at the level of your heart. So what that means, if your feet are dangling on the table, no good. If your arm is hanging at your side, no good. If your arm is resting in your lap, no good. And it's not going to make it falsely low. It's going to make it falsely high by as much as 10 points. Wow. What's the problem with that? Well, all of a sudden, you've got a diagnosis of high blood pressure, hypertension that isn't real. That you might be put on medication that you don't need. Goes right on your record. That's not going to help you in terms of getting insurance and implication for other things. So you got to speak up. You got to speak up. And people always say, I don't know how to speak up when I'm at the doctor's office. What do I say? Well, what you don't say is you clearly are clueless and you have no idea how to take a blood pressure. That generally doesn't work. What works is to say, you know, I heard on WGN News that there's some study that it actually makes a difference. And would you be willing to take my blood pressure with my feet on the ground and blah, 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 and let's just see if it changes, you know, kind of a friendly way. Okay. It's all about how you frame it.
Absolutely. A new study about most mass killings are not due to mental illness.
Okay, now let's, and I want to be clear. We were just talking about serial killers.
Yes.
A serial killer is different than a mass murderer,
Yes.
who basically, it's a one-time thing. Now, you know what happens. Every time one of these tragedies happens, the first thing that people say is, well, we have a mental health issue in this country. It's not a gun issue, it's a mental health issue. So there finally was a study. So if you look at the rate of mental health issues in the general population, it's about 22, 23%. Okay. The rate of mental health issues in people that commit a mass killing, want to guess?
Gosh, I wouldn't even know.
I don't know, but are we talking?
23%. It's the same.
The same.
It's
the same. It's the same.
Okay.
So it's rage, it's anger, it's hate, and it's access to guns.
Interesting.
Yeah, but are we considering, does that consider only documented cases of mental health history, or is it someone going through a temporary mental health crisis? Is that a distinction worth discussing?
I think it is worth discussing, and I wondered the same thing. When are they having their mental health evaluation? Is it after they've killed 10 kids at school, or is it before? And I tried to find that out in this study, how they were defining that, and I really couldn't find it. They just, it was kind of statistical.
Interesting
But
topic.
it is interesting. I mean, very clearly, even if it is higher, it is certainly not this idea that, well, if someone does this, it must be a mental health problem.
Not always true.
It's generally not.
Interesting. Dr. Stryker, thanks so much. You can follow Dr. Stryker on Substack.
Thank you, Doctor.
Thank you.
Time now for On Time.
Hey, Anna.